What is pyloric stenosis? Pyloric stenosis, also known as hypertrophic pyloric stenosis, is a condition in which the muscle of the pylorus becomes abnormally thickened. This thickening leads to a narrowing of the passage between the stomach and the small intestine, creating an obstruction that can prevent food from passing through, causing vomiting and other digestive issues in infants. Although the exact causes of pyloric stenosis are not entirely understood, it is believed that a combination of genetic and environmental factors play a role in its development. The condition is most commonly diagnosed in male infants and often requires surgical intervention to correct. What are the symptoms of pyloric stenosis? The symptoms of pyloric stenosis are often quite distinct, with projectile vomiting being one of the primary indicators. This type of vomiting is forceful and can occur soon after feeding. Infants with this condition might seem unusually hungry and exhibit signs of discomfort during and after feedings. Other symptoms include dehydration, weight loss, and changes in bowel movements. Parents may also notice wave-like contractions across their infant's abdomen, which is an indication of the stomach trying to force contents through the narrowed pyloric valve. How is pyloric stenosis diagnosed? The diagnosis of pyloric stenosis typically involves a physical examination and imaging tests. An ultrasound is often the preferred method, as it can reveal the thickened pyloric muscle. In some cases, blood tests may also be conducted to assess the infant's electrolyte levels and overall hydration status, which can be impacted by repeated vomiting. During the physical examination, a doctor might feel an olive-shaped lump in the abdomen, which is the enlarged pyloric muscle. This finding, coupled with the infant's symptoms and ultrasound results, can confirm the diagnosis. What are the treatment options for pyloric stenosis? The primary treatment for pyloric stenosis is a surgical procedure known as Pyloromyotomy. This surgery effectively relieves the obstruction by slicing through the thickened muscle tissue, allowing food to pass through to the small intestine. Before surgery, infants will likely need to undergo stabilization with intravenous IV fluids to address dehydration and any electrolyte imbalances. Post-surgery, the prognosis for infants with pyloric stenosis is generally excellent, with most experiencing swift recoveries and returning to normal feeding routines. What are the risk factors for pyloric stenosis? Certain risk factors for pyloric stenosis have been identified, including being male, having a family history of the condition, and maternal smoking during pregnancy. Research suggests that these factors can increase an infant's chances of developing the condition, although the connections are not fully understood. Additional factors that may contribute to the development of pyloric stenosis include early antibiotic use in infants and certain environmental exposures, though further studies are needed to corroborate these associations. Can pyloric stenosis cause problems later in life? While pyloric stenosis can be a distressing condition for infants and their families, the long-term effects of pyloric stenosis are typically minimal once the condition has been treated. Most children will not experience ongoing problems related to the condition as they grow older. However, it's important for parents to monitor for any potential gastrointestinal issues and to maintain regular checkups with their child's pediatrician to ensure proper development and health. Pyloric stenosis in adults, is it possible? Pyloric stenosis is primarily a condition that affects infants, with cases in adults being extremely rare. When it does occur in adults, it is often due to other underlying conditions that lead to pyloric obstruction, such as peptic ulcers or gastric cancers. In such instances, the symptoms may resemble those seen in infants, but the diagnostic and treatment approaches will differ, taking into account the adult patient's overall health and any other medical issues they may have.